Test 1 2.
Hello?
Yep. Okay. We ready?
Yeah.
Hello, test. Testing. 1, 2, 3, 4. Here we go. Well, here's a guy or a woman that says bromodosis. All Frank Zappa fans know that. Is there a song? I thought I know Frank Zappa pretty well.
Never heard of it.
You remember bromodosis, right? Oh, Stinkfoot. Yeah, of course. Yeah, okay. Right. That's hilarious. And then this person says PureWick is known as the Cooter Canoe. I wish they'd call those in, though. If you guys text me this stuff, I really can't use it. But
Are you on the chat?
No. I'm in Google Voice, our voicemail line.
Okay. Let's see. Yeah. I don't see any of those things.
No. All right, here we go. Sorry.
It's time for Weird Medicine with Dr. Steve.
I've got diphtheria crushing my esophagus. I've got some bowler dripping from my nose. I've got the leprosy of the heart valve, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic echographic and a pulsating shave. I want a magic pill for all my ailments, the health equivalent to Citizen Kane. And if I don't get it now in a tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve.
It's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio and the longest running show on this channel. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medicine provider who gives me street cred with the wacko alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
In addition, we have my partner in life and everything else, Tacey. Hello, Tacey.
Hello.
This is a show for people who had never listened to a medical show on the radio. If you got a question you're embarrassed to take to your regular medical provider, or if you can't find an answer anywhere else, give us a call at 347-766-4323. That's 347-POOHEAD. Visit our website at drsteve.com for podcasts, medical news, and stuff you can buy I can't mention contractually. Most importantly, we are not your medical providers. Take anything you hear with a grain of salt. Don't act on anything you hear on this show without talking it over with your doctor, nurse practitioner, physician assistant, pharmacist, chiropractor, acupuncturist, yoga master, physical therapist, or whatever. All right, very good. So please check out Dr. Scott's website at simplyherbals.net, simplyherbals.net. Anything going on over there, Dr. Scott?
No, just the same old, just the mostly nasal sprays.
Yeah.
Lots of nasal sprays.
Well, 'tis the season.
Oh my gosh, it's been awful. There.
Yeah, this has been a bad one.
You know, I was saying this has been the most beautiful spring I've ever seen here.
Yeah.
But the side part of that is that, you know, with a beautiful spring, I guess, comes extra pollen.
Yeah.
Who knew?
Yeah.
Oh my God, it's awful.
Yeah.
I have never seen this bad.
Well, and I think also we had a really warm winter.
Yeah.
And that doesn't kill a bunch of stuff, and so more stuff is still alive.
Yep.
Plus, if it was damp, which it was,
yeah.
then you've got more mold and just shit floating around. So
Yeah, you know, and it looks like too. It just seems like we had such a wonderful, you know, wet spring, and everything's growing so robustly.
It
It's
is.
like it continues to
yeah,
to grow and create more pollen, which I think we lost a lot of last year. Remember, we had that late frost, and it almost killed some of my trees. And this
Yeah.
year they've doubled in size. It's just crazy.
Yeah.
He says that as Rosie sniffs his crotch.
Oh yeah.
She's
Yeah,
she's well trained.
Rosie and Ralphie are here.
Yes,
I don't know if we'll
she's a
get them
good
on
baby.
camera.
She's a good baby.
I don't know if you can see Ralphie. What's he doing? He's
Ralphie's
just
not such a good
watching
baby.
Tacey drink.
Rosie's a good baby.
I remember when a long time ago we had Ozzy. When we had Ozzy, and he would lay in the corner, and he was such a big dog. His respirations were so loud. And I remember we would ask him his opinion, and I would just turn his mic on, and he'd.
Yeah. He was a good one, wasn't he?
He was a good.
Oh, gosh.
All right, very good. All right, Dr. Scott, you got some stories for us?
Yeah, we keep hearing about this monkeypox.
Okay.
So I thought we'd talk about that for just
We
a
do
moment.
need to
we
talk
should.
about monkeypox.
Yeah, because it's something we haven't really covered.
Here comes another,
pandemic.
It's
Another
not.
And it's not.
Number
Yeah.
one, it's not.
not.
But
Well,
anyway, go ahead.
Well, and I think that's what a lot of people have been asking me, and I know they've been asking you too. And the bottom line is the monkeypox has been around for a long time.
Yep.
Similar to the coronavirus.
Probably
The-
been around for a long time. It was first discovered in 1970
Yeah.
in humans.
Yeah,
That
but
was the first time it was. But yeah.
Yeah, I'm sorry,
it's-
but they just hypothesized it's been around for years, and they
Yeah,
and they
of
say
course.
it's in the same family as the smallpox.
Yep.
But they were just talking about a couple things to remember. This is not COVID. It is not spread like COVID. It's with the monkeypox. It has to be almost skin to skin contact and over a long period of time.
It's not like smallpox,
Yeah.
which was very contagious, and it's not
Right, or-
like
and not-
chickenpox,
or not
which
like-
is also very contagious.
or not like COVID, which you can be in the
Smart.
same room, but with it. But yeah, it has to be typically up close skin contact for a longer period of time.
Yep.
Yep.
Yeah, because it's not. It doesn't like living in humans. It will live in humans. So probably with monkeys, they're spreading it all over the place. It might be. I don't know what.
Strutting their stuff.
I don't know what the
Sharing it
contagion
pox.
number for monkeypox is in monkeys, but it's very low for humans.
Yeah.
And yeah, they it was first identified in Zaire, and then when a 9-year-old boy developed a smallpox-like illness, and they had thought at that point that smallpox was nearly eradicated, but so they were still running around trying to catch smallpox cases. And this one was different, and it was confirmed as human monkeypox. And then they had similar cases in 1970 and 71 in Liberia, Nigeria, and Sierra Leone.
Okay.
And it was when it was first identified, it was limited to the rainforests of Central and Western Africa. And then 2003, we saw cases in Western Hemisphere. Of course, we're a global economy, and people are moving around a lot more mobile now than they used to be. And in 2003, there were a lot of people identified in the Midwestern United States who developed fever, rash, and these respiratory symptoms, and lymphadenopathy, which means enlarged lymph nodes. And they were exposed to pet prairie dogs, and the prairie dogs were infected with monkeypox.
Oh my goodness.
Isn't that crazy?
Yeah.
So we could call it prairie dog pox. But yeah, most of the confirmed cases were from direct contact or exposure to ill prairie dogs, and the prairie dogs had profuse nasal discharge and ocular discharge. So they had stuff coming out of their nose and their eyes, and they were breathing fast. So if you ever see a prairie dog that's snotting and looks like it's crying and it's breathing, stay away from it.
You're probably too close anyway.
Don't help it. Right.
Yeah.
If you can see that,
Yeah.
you're too
You're
freaking
too close anyway.
It's true. Very well said.
Oh my gosh.
So other rodents can carry it as well, but then humans can just get it and pass it from person to person. But that's harder to do, and it looks like a regular pox type virus. It makes pustules and then they burst and they ulcerate and stuff like that. So the current outbreak is evolving. There was one case of monkeypox in each of the following U.S. states as of May 25th, which is today when we're recording that. That's California, Florida, Massachusetts, New York State, Utah, and Washington State. And so we'll just have to keep an eye on that. But mortality rates range from 1 to 10% in Africa, but there have been no fatalities in the United States in the 2003 outbreak, so we don't expect any. We've gotten a little bit better at treating stuff like this, so we'll
Right.
just see.
Right.
If you had the smallpox vaccine, you're good.
Huh.
It's felt to be cross-reactive. If you get monkeypox, it'll be milder, and you may be protected from getting it.
Well, that's pretty cool.
So are you supposed to? Do most people have the smallpox?
Well, they
vaccine?
stopped doing it after they eradicated it. Well, let me see. That's a great question, Tace.
Of
No,
course
Taste.
it is.
Pox.
Tacey, you and I might be in trouble. He's probably
Vaccine
okay.
Discontinued. Let me see.
Back in the good old days when Dr. Steve was young.
Yeah.
before us.
Okay, it was
Just a
successfully. Okay, smallpox vaccine was stopped in 1972 after the disease was
Oh,
eradicated in the
man.
United States. So
I
if
missed it.
yeah, Tacy would have missed it. So anybody born before 1972 probably got
Me.
smallpox vaccine.
But
You know,
not by
I'm
much.
already seeing on Facebook. I'm going to refuse that jab too. I'm already seeing, and I've seen that not just once or twice, but about 20 times.
Yeah, this isn't smallpox. I don't think they're going to ask for vaccination for this one.
Well,
But if
I know
smallpox
people who
was-
aren't going to take it anyway.
Well, okay, fine then. But if smallpox was still a thing, they would all be lining up to get it. If people had seen what I saw, I mean, and my grandmother saw, when you would have 10 kids because you'd hope that 3 of them would survive because these fucking viruses
Yeah.
and bacteria and stuff, tetanus, rabies. I mean, come on. Now, I wonder how many people who don't want to get these jabs, maybe just they don't want to get it because it's new, and I get that. I believe it or not, I do understand people's reticence on that. But are they cool if they got bit by a rabid bat? Would they get vaccinated for that? So they're not against all vaccines; they're just against new vaccines. Well, there were people back in the day that were against influenza vaccines, against all of the vaccines that have really made our lives better. And there were people at that time that were against those as well. And still people today, a subset of people don't want to get the measles vaccine, even though measles kills 1 kid out of 1,000 that it infects, and killed one of my friends in kindergarten because we didn't have measles vaccine back then.
Yep.
So, anyway. All right. Yeah, I don't blame them. Right now, I wouldn't recommend people run out and get a smallpox vaccine for monkeypox. It's just, know your partner if you're going to be having close, intimate contact with somebody. All right?
Mm-hmm.
Good one, Scott.
Oh, yeah.
What else you got?
Well, interestingly, especially
I'm glad, you know what? I'm glad you brought that up because I didn't even think about talking about monkeypox today. It's like, no, people are talking about this. I'm an idiot when it comes to coming up with topics for the show
No.
that are topical.
Yeah, certainly current, very current, which is cool.
Thank
Yeah,
you for bringing that up.
Yeah, but now this is right down your lane there, Dr. Steve.
Okay.
First human patient is injected with revolutionary cancer-killing virus after successful test on animals show it can shrink colon, lung, breast, ovarian, and pancreatic tumors.
Wow. So this
Wow.
is a viral oncolytic therapy. Tell
it's-
me more about it.
It's an oncolytic virus. It's called Vaccinia. It's been specifically genetically engineered.
Vaccinia has been around for a long time.
Vaccinia.
But I mean,
yeah.
it's a known virus, so they must have engineered it.
Okay.
in some
Okay.
way.
Yeah. That's it. I guess that's what it is. But what they've seen is that it can help prime the patient's immune system to not only attack certain types of cancers, but also to increase immune response. So they're genetically engineering it to fight certain cancers.
Interesting. Well,
Immugene Limited, I guess, is the company that's they specialize in novel treatments for
Yeah.
immunotherapies.
Vaccinia is a well-known, well-studied virus that belongs to the pox virus family, so it's topical in that regard.
Okay.
And it's got a big, giant, linear, double-stranded DNA in it, so it's kind of easy to mess around with its genetic makeup.
Okay.
So I'd like to know more about this because, number one, you don't want this virus getting out of the patient.
Mm-hmm.
So they have to genetically modify it to decrease its virulence, because we don't want I Am Legend to happen, you know.
No.
Because that was a cancer vaccine. If you remember Emma Thompson at the beginning, it was a great sort of red herring that you've got Emma Thompson in this movie at the beginning. You're like, oh, she's going to be in the movie the whole time. She was literally in it for a minute, talking about how spoiler everybody, the movie came out 20 years ago, how she had developed a vaccine for cancer, and the next thing you know, the next scene is just zombies running around wild, and one guy was not affected. But it was a pretty good movie. The book was better, I'm going to tell you that. But the movie had kind of a hopeful ending, whereas in the book, spoiler, the book came out 50 years ago. He met with the vampires. They were more sort of vampires in the book. And he met with them, and they said they were terrified of him. That was the thing. They were coming after him because they were scared of him, because he was different than they were, which was pretty interesting. You know, he could walk in the sun, and they couldn't, and all that stuff. But anyway, yeah, check that out.
That's
it's
cool.
a good book.
Yeah.
The Vaccinia virus. So oncolytic therapy is a big deal. Eventually, we will be taking people's own cells out and training them to do this. But right now, what they're using these viruses for is to attack certain cells and then signaling that these cells need to be destroyed, and then the immune system comes and does it. So on our website at drsteve.com, if you click on the link that says pseudoscience, non-pseudoscience cancer cures, there's a story that I had about multiple myeloma being treated with measles vaccine. So measles vaccine is a live attenuated virus, and they genetically engineered it to accept radioactive iodine, not for therapeutic purposes, but for tagging purposes. So they gave this person 6 million doses of measles vaccine.
Jeez.
And they got kind of ill, but when they got over it, they injected this person, if I remember this correctly, with a low dose of radioactive iodine, and then those measles viruses should have made receptors on the surface of the cells to pick up that radioactive iodine. And when they scanned these people, the measles vaccine lit up the multiple myeloma. Multiple myeloma, for people that don't know, is a cancer of the bone, and it's called multiple because it's everywhere. And it infects lots of bones and causes painful tumors and stuff like that. So it lit these cancerous tumors in the bones up when they scanned them, and then within about a month, all the cancer was gone. Now, this is a very limited trial. They just did this as a proof of concept kind of thing, but it was amazing. So I knew back then, that probably came out 10, 15 years ago, that they would start to commercialize this, and I'm quite sure that this study was funded by someone that wants to make $1 billion off of this. And if it works, God bless them. Because I've always said these kinds of treatments probably wouldn't help me, but they would help my kids and my grandchildren. This kind of stuff, if they're this close to doing a clinical trial, if it's a phase 1 trial and it works, we'll be in phase 3 trials in no time, and then it'll hit the market in a year or two. So it might help us after all.
Yeah, I believe they're in phase 1 clinical trials.
Yeah, so this was a phase 1 clinical trial.
Yeah.
So remember, everybody, that phase 1 clinical trials are proof of concept. You give it to maybe 40 people just to make sure you're not killing them. And then you could do a little bit of efficacy, see if it works kind of stuff. But there's not large enough numbers to see rare side effects or to make any big claims about how effective it is. Then you do a phase 2 with maybe 300 people to look for safety. And then you do a phase 3 with 3,000 to 30,000 people to look for rare adverse effects and to lock in the effectiveness of this treatment compared to a placebo. And then if you can show statistically significant benefit and it's safe, then the FDA will let you put it on the market. And then you do phase 4 study, which is post-marketing, when you've got millions of people. And that's when you'll pick up really, really rare adverse effects. You know, the 1 in a million kind of stuff. So that's very exciting.
Pretty cool stuff.
Yep.
Let's hope
Cancer cells often have impaired viral defenses because they're just shitty cells that shouldn't even be there. And that makes them susceptible to being infected by these viruses. And the viruses can be engineered to give them some advantageous properties. And it could be decreasing their ability to infect healthy cells and granting them the ability to deliver therapeutic payloads even to these tumors. So it's not just making the immune system. You know, if you could engineer a virus to only go to cancer cell, and then you could put a couple atoms of radioactive radium inside there and let it deliver that would be cool.
Yeah.
So you'd be giving radiotherapy to these cells, and it's only killing the cancer cells. That's a pretty neat thing. It's like a smart bomb. All right.
That's crazy good.
Yeah, it is good. All right. Very exciting. Well done, Dr. Scott.
Thank you, sir.
All right. We have any questions in the waiting room?
None yet.
Okay, that's fine. Let's take a couple phone calls.
Number one thing, don't take advice from some asshole on the radio.
Tasty, you got any questions for it? Oh, we should talk about, before we take questions, do you want to talk about what you went through today?
Well, I went through some vaginal rejuvenation.
Excellent.
I don't really know how to talk about it intelligently because, well, first of all, not intelligent.
Yes, you are.
Secondly,
that.
though,
Boo.
I went through. I underwent 2 procedures, and one was like a bullet that you put in your vagina, and it kind of sends radio frequencies.
Okay.
And so I could feel the places in my vaginal wall that were weak.
Really?
Yes. So, because that's the only place that it hurt. But it's got like metal plates on either side all around it.
Yeah.
And it feels like it's opening and closing, but it's not. It's just sending out radio frequencies.
Right. Might be causing some spasm of the muscles.
Yeah, and then you can increase it on your own time.
Really? You had control over it?
You have control over it. So when
Can you lift your mic up just a little bit? I want to hear this. There
when,
you go. Yeah, that's beautiful.
You're
Thank
the
you.
only one. when
No, this is interesting.
was
What you
good.
had was a thing called Votiva.
Yes.
And I'll talk about what it is I want to hear your experience with
so
it.
yeah, it doesn't hurt. I mean, you start off at 0 and you increase it by yourself, and they put you in a room alone, and then you increase it by 2 degrees every time.
Did they insert it or did you insert it?
She inserted it for me. It also had some numbing cream on it for the next procedure I underwent.
Okay. Because I was going to say if they just put numbing cream on it and stick it in there, that's not going to do anything.
No.
That's
So-
like what Dr. Scott and I had our urethral
Ugh.
sounding,
Oh,
and they put gel on there just to make themselves feel better. It didn't do anything for us
it was
whatsoever.
numbing cream for the next procedure.
Okay, good. I like that.
Not for that one because you don't need it for the first procedure.
Okay.
Since you're in control over it. Now, if you put that at a high radio frequency, if you put that in, you would definitely need numbing cream. But I don't think numbing cream would necessarily help with that.
Yeah.
Because I remember the last time I had it done, I coughed and it shot out, and I put it back in.
Okay. Okay.
Well, it's true.
yeah. What else would you do
Things
with it?
are loose down there.
Yeah.
So I coughed and it shot out, and I put it back in, and I didn't know that.
There are people that make a living doing that.
And
kind
I
of
thought
stuff,
I
you
was
know.
gonna
So they
come
use
up-
ping pong balls.
Yeah,
So.
well, yeah, I thought I was going to come up off the table
Yeah.
because it hurt so bad because the plates were not in the same place.
Oh.
Because
Okay.
you can rotate it if you want to.
So you should. You mean with the controls?
With just with the bullet. I mean, just with your hand.
Oh,
just-
okay. I
'cause
was sort
it's-
of imagining like a video game controller.
Yes, and the second thing was called Morpheus,
Okay.
I believe, And I don't want to speak out of turn, so I'm not a representative of
No,
the
no, no,
company.
no.
I'm only a
Yeah,
patient.
we want to know your experience, and I'll talk a
My
little bit about what
experience
the machine
was
is.
it has little needles that come in and out.
Microneedles, yeah.
Yes, and I don't know how deep they go, but you can definitely see them because I saw them push it before it went in, and it freaked me out a little bit.
Ooh,
And also radio frequency at the same time.
yeah.
So
And what's the purpose of all of this?
to get better bladder control,
Okay, yeah.
to just rejuvenate the vagina, better bladder control. I think a lot of people do it so that it will look better. Although I really don't spend much time looking at it, so I don't care that much.
No, I don't know
what it
who
looks
does
like.
look at it. Even if you're down there
I
doing
think
stuff, you're not
some
looking
people
around.
do, and I don't think it's in the 20s range. I think it's the 50 and 60-year-old women who are dating younger men
Excellent.
who get concerned about the way that it looks.
Okay.
And the pictures that I saw when I went to the talk about it were phenomenal.
Yeah. Yeah, I
And
did the training on it. It was pretty outstanding.
It's three
again,
treatments.
this is not an advertisement.
This is definitely not an advertisement.
Very interested in your experience, though.
I just feel like it didn't hurt. Of course, I had numbing cream in for 30 minutes because I did the first procedure for about half an hour.
Yeah.
And then the second one took about as long. But she just rotates it in a clockwise fashion. And
So this one, you've got the person in the
person
room.
is in the room with you.
Can we
And
get some mood music for this, please, Doctor?
I'm sorry. Oh, God. What's wrong with
What's
me?
wrong with you?
Yeah,
With a
please,
little
I
help
need
from
music.
David. There's a little help from my brother,
And
Dave.
she pushes a pedal, and the
That's
radio
hot.
frequency happens, and the needles come out and come back in, and it doesn't feel that way at all.
It's fast.
It's very fast, and I mean there were a few uncomfortable moments, but not in the way that you would think.
Yeah.
But of course, I had numbing cream in for half an hour
Right.
at least before they did the procedure.
Let me ask you something. If you didn't know me and you came in and I did this procedure on you, would you be uncomfortable with, would you think that I was
Well, considering the
being
type of doctor
inappropriate?
you are, yes, I would be very uncomfortable. with it.
true? Oh, I went to this hospice doctor and he put, no, I get that. But
However, there are male physicians who do it. If you went to a plastic surgeon,
yeah,
then you would expect that.
you would have to give real informed consent on this one to
yeah.
say this is what the procedure is. Because if you just start sticking this thing in and going in and out with it and going all over the place, because they go all over the place too, right?
Well, I have it all over the place on the outside. It was a
Yeah.
little tender on the outside.
I would say so.
Well, I have the informed consent right with me, and I have page 12 that I signed.
Okay.
So,
Well, nobody reads those, though, but I'm just saying you would have to tell people, hey, this is
Yes.
what we're going to do. Because if you just started doing it without giving that informed consent to the patient, you would be in trouble really quick, I think. But so this thing uses high frequency radio energy to stimulate blood supply, increase blood supply. We call it angiogenesis to those walls. And the purpose, from what I understand, is to avoid having surgery if you've got stress incontinence. So if you've got a woman that's had a couple of babies and maybe their estrogen levels aren't as high as they used to be, and the bladder wall, which the bottom of the bladder is the top of the vagina, is starting to thin, they will often get some laxity in that wall, and you can end up getting overflow, or you have difficulty emptying your bladder, or you may get incontinent when you sneeze or you lift something, and those kinds of things. And we talked about that last show or the show before.
yeah, I could feel it when it was up against like when I say up against,
Yeah.
near my bladder area.
Yeah.
Because I felt like I needed to urinate.
Interesting. Okay. Well, I'll be very interested to hear your results with this and see if you
Yes.
notice a difference. It's not like I don't want anybody to get the impression that my wife is just pissing everywhere, because that's
No.
not the case. But she's texting, so she's not listening.
Our
to
son
me,
has
but-
lost his wallet.
Uh-oh. Do we need to go help him?
He's freaking out about it. He's
Okay,
just
do you want to
that's
go
why
help
he's-
him?
Well,
I mean, we can stop. I can stop recording.
let's finish this little segment and then I'll go.
Okay.
And so
Just text to him, I'm talking about my vagina. I'll be right down. That's always a great
I'm just
thing
gonna
to
say,
say
I'll
to your
be right
19-year-old.
Mm-hmm.
down.
We need to put one of those Apple Find It things in his freaking wallet because this is not the first time.
So, anyway, it was very interesting. It wasn't as painful as I thought, and I'm very anxious to see the results. And no, I
Yeah.
do not pee on myself all the time.
Right. Thank you.
But the majority of women my age, if you ask them if they've had children, when they laugh or if they cough, what happens, or
Yeah.
if they're exercising, what happens, or how many times they go to the bathroom at night. I know with our new fancy mattress, you don't wake up every time, but it's about 6 or 7 for me.
Is that right?
Oh,
Yes.
jeez, that's way too
I
much.
had no idea.
That's way too much.
So
No, we have this highfalutin mattress, and I mean, it's one of those where if you put a wine glass on it, the person could jump on the other side. And it was more money than I wanted to spend, but we got a really good deal on it. But it was the best purchase we ever made.
It really was.
And I had no idea you were getting up that often. I don't
And-
know how you get any rest.
well,
She's
you
retired.
you get used
She
to it,
sleeps
and
all
then
day,
I take a
for the most
nap.
part.
Fair enough.
She sleeps all day.
But enough about me.
All right.
And I'm going
Thank
to go
you.
help my son find
Yeah,
his,
please let me know, and then when you come back, you can tell
his
us.
wallet.
Okay.
And
I'm just going to take your mic.
I'm
down.
sorry, everyone.
Probably in his dirty
You're fine.
blue jeans. Hey,
Yeah,
talk
it'll
like,
be in his
talk
car.
like a hit. Hicks got a question. Is
Okay.
this is it advice for someone with vaginal tissue, thin vaginal tissues, and estrogen cream? I don't know.
No, wait. What's the question?
Is that procedure recommended for someone with thin vaginal wall?
Yeah, that's
tissue?
what it's for.
Okay, that's what I thought. But
So if you have atrophic vaginitis, you got to talk to them because depending on how thin you are.
People who have prolapses?
Yep.
Yep.
And Tacey is saying that they are recommending it for people with cystoceles, which is a really low blooping, for want of a better medical term, blooping down of the bladder wall into the top wall of the vagina or into the vagina itself. So, but you need to go to somebody that knows what the hell they're doing.
Yeah.
And talk to them about the risk benefits and alternatives. That's, again, not an advertisement. I just thought that was fascinating what she went through. And I've trained on this machine, but she's the first person that I know that's actually done it.
yeah. How many needles do
Oh,
they
God.
use?
It's the head has a matrix of needles in it.
You know, you would think it kind of plumps up that thin wall and maybe cause a little scarring underneath
Well,
too.
yeah,
helps
it's
rebuild a little bit of the
Not
the
supposed
fascia.
to scar,
I mean,
but
micro scars.
yeah.
Just to kind of pump things up.
Causes some inflammation
Yeah.
and blood, capillary
Yep.
production
Yep.
and increase in tissue production, and it starts up.
Kind of wakes it back up.
Starts up, tissue regeneration.
The
So,
healing process. Yeah.
yeah, it's pretty interesting.
That's cool. Good stuff.
All right, good deal. Let's see. Okay, this person wants to know, do you know anything about glutathione as a supplement?
I take it.
You do? Okay,
Yeah.
well, let's listen to this.
I don't say that I don't know anything about it.
Okay, let's listen to this one and see.
Hi, you've reached Matthew
Hey,
Frost.
Dr. Steve.
I'm unavailable at this
I had
time.
Whoops,
somebody
what?
who
Leave a
Whoa,
message
whoa,
and I'll
whoa.
get back to you
What
as soon
the
as
hell? Okay.
At the tone, please record your message. When you finish,
Okay, I gotta take that out. Hang on.
Okay.
Okay. Hang on. Sorry, everybody. Well, let's listen to this one then and see what he's got. Hang on. Here we go.
Hey, Dr. Steve. I had somebody suggest glutathione to me as a supplement. Can you help me understand what it is and what does it do? And would it be a good supplement to incorporate into the supplement?
Yeah, the thing is, what do you want to accomplish? I always ask people about that. If is vitamin D good for you? And it's like, well, what do you want to treat? Do you want to prevent rickets? Well, vitamin D is freaking great. You want to prevent cancer? Well, maybe not.
Right.
There's not evidence for that yet. So, but you take glutathione, so what are you taking it for?
Yeah, I do. Well, they say it's supposed to help with free radicals and inflammation, and I take it because I can't take NSAIDs
Okay.
for my inflammation, my gout, et cetera, et cetera, et cetera. But evidently glutathione is made of a couple small amino acids that can help, maybe possibly help fight free radicals, maybe helping fight against inflammatory diseases.
My
Possibly,
concern
yeah,
about
possibly.
free radicals is this. So free radicals are this quote-unquote toxin in the body that are very reactive. And what the concern is that free radicals running around in your body can cause cancer.
Mm-hmm.
So the people started taking antioxidants. That's what those are for, is to sort of mop up free radicals. The problem is that our immune system uses free radicals to kill stuff.
Okay.
That's my concern about it.
Right.
And there were a couple of studies where people were taking antioxidant medications that actually, if they were still smoking, that actually increased their risk of cancer. So I'm always leery when I hear things about mopping up free radicals because white blood cells actually generate those to kill things. You know, when they envelop other cells or bacteria, well, how are they going to kill them? Well, they generate an area, a gradient of free radicals in some cases, and that's what kills the bacteria. So those could be good. If you wiped all that up, then maybe that would be a bad thing. That's theoretical.
Okay.
So according to this thing I'm looking at is glutathione helps reduce oxidative stress, just the way you said, by either stimulating or reducing the body's immunologic response. Well, which one is it? Does it stimulate or reduce it? So I'm a little concerned about that. Autoimmune diseases attack mitochondria and specific cells, and glutathione supposedly works to protect cell mitochondria by eliminating free radicals. And again, that's my concern about it. So if there was a specific reason that you were going to take glutathione, I'd be all in. I don't know what the data is, and I'm not finding great data either way that it's either bad for you or good for you. I just can't find any studies right now that show me either way. So
I've got an article here, and it's a big article, but it's in PubMed about oxidative stress on the brain.
Yeah,
especially following head injuries, CTEs, PTSD, et cetera, et cetera.
Okay.
And I'll dig in a little deeper before next week. Maybe we can talk about it then.
Okay.
If you want to do that, I'm trying to get to the end of it right now, just to see if there's
Yeah, there's just not enough scientific evidence that I'm aware of.
Right.
And if anybody out there has a good double-blind, placebo-controlled study with an endpoint that we're interested in, I would be happy to look at it. And Scott and I will look at that.
Yeah.
Leave us a note, and maybe we'll do that as a story next time. See
that'd be
if we
great.
can find
Yeah,
something.
because it might be beneficial. It might not be. So
Yeah,
we'll look it up.
You know, I've seen glutathione given IV for things like atherosclerosis and diabetes and things like that, and for side effects of chemotherapy. But those are really specific uses that still are off-label. I mean, they're, as far as I know, they're investigational. So
We have to be really careful with, during patients undergoing chemotherapy, giving them things to keep down the oxidative stressors and we don't give any herbs that are going to help to stop the process of the chemotherapy working.
Yeah, no, that's right.
With those free radicals. So
now I'm looking at a study in evidence-based complementary and alternative medicine.
there we go.
Dr. Scott's attention. I got his attention with that.
Hey,
where they were using nebulized glutathione, but I'm still not seeing good. I mean, a lot of this stuff is just they're guessing at things. So I want to see double-blind, placebo-controlled data. I'm sorry. I'm interested in things that have been used in rats and shown some benefit, but to take those straight to humans just because we think because it's a related amino acid that it's not going to be a problem, it bothers me. So
yeah, Mick says that it's good for hangovers.
Really?
Yeah.
Okay.
For liver toxins.
Well, by God, let's look that up. let's look
We'll
up.
have to.
We're going to
check.
PubMed.gov, and I'm looking up glutathione.
Might have to try an N of one. I'll give it a shot and
Hang
see what
over.
happens.
Okay, fair enough. Okay, here we go. Effects of a preparation of combined glutathione-enriched yeast and rice, embryo, soybean extracts on ethanol hangover. Okay, and this is in Journal of Medicinal Food in 2009, and they said it suggested that this reduces blood concentrations of alcohol and acetaldehyde. Remember, acetaldehyde is one of those products of ethanol production or metabolism that causes headache and just nasty side effects. Not only by modulating alcohol metabolizing enzymes, but also by exerting its antioxidant activity. There we go again. And it should be a promising candidate for improvements in alcohol hangover. Of course, that was in 2009. I don't see anything since then. So, but that's interesting. Okay, so who said that?
It's not Colin. It's Mick KM.
Okay, well, I'm gonna give yourself a bell for at least giving us something interesting to talk about. So, leave us a note, Scott. We'll talk about this next time.
Gotcha.
See if there's anything interesting about glutathione. All right. Uh-oh. Here we go.
Hey, Dr. Steve.
Hey, man.
Dr. Scott, Casey.
Hey. Hello.
I was calling about last week's, or maybe it was this week's that I just listened to, about pooping in the bookstore.
Yes.
And I would just like to bring up the fact that...
Okay, so we were talking about this Mariko Aoki effect, where people found an association between walking into a bookstore and needing to move their bowels. And I really wanted to go to Books A Million and just ask if they've noticed that people make a beeline to the bathroom, but I forgot to do that this week. But
when people go to purchase cocaine, they always have to poop when they get it.
What?
And that was always tied back to people cutting cocaine with baby laxative.
Oh, I thought it was because they're scared shitless.
So I don't know.
when they're buying
I
it.
just thought that was interesting about the bookstore.
Oh, that's interesting. I know that lots of things you can cut heroin with, and I wasn't aware that they were doing that with cocaine. But if you're snorting it, I can't imagine that you're getting enough to give you a laxative effect. I do know when I was in Aruba, this friend I was with, this was in the 80s, wanted to, cop man. And so we took a cab to some place, and he asked the cab driver if there was a place where he could buy something. And we went to, I was so, and so they met these people, and he got out of the car. I was so terrified that the cab driver was going to drive away.
You pooped yourself.
No, but I kept giving him money. It was like, here's another $5. Here's another $5. It was like I was at a strip club or something. I just, every minute I was giving him more money just to make him stay there, because I was scared shitless. But I didn't actually void my bowels. So, all right. Let's see. Okay. Oh, this is a good question here.
Hi, Dr. Steve.
Hello.
This is Calvin from
Hello,
California.
Calvin. Okay.
So I have a normal, healthy body and normal, healthy skin. I don't have hydritis. No, I don't have eczema, anything like that. But when I play video games, sometimes when I'm concentrating really heavily, I start getting these itches like methamphetamine spiders all over my dermis.
Yep.
What's up with that?
Yeah.
Thank you so much.
No, that's a well-known effect. He has excitatory histamine release. So we've talked about people who go out into the sun and they will start sneezing, and other people who will go into the cold and they'll get hives, and some people will get histamine release when they get excited. And when he's playing video games, his adrenaline is pumping. Probably someone is calling him naughty things. Yeah, on the over the headset, and he's getting excited, and he's getting histamine release that causes what we would say generalized pruritus, which is just a fancy term for itching all over. And he may be getting hives too, and just not noticing it because he's playing video games. So that's what that is.
Excitatory histamine.
That's
release.
right.
Bingo.
What do you think of that?
I like it.
All right, good. Thank you. I like it too.
What's up, Dr. Steve? This
Amen.
is a stupid question, but I feel like you're the
No
only
such
person that
thing.
could answer it straightforward. When a pilot is in, a fighter jet and they're going like fucking 30 G's or whatever it is. I heard that the blood like comes down, like it goes down toward their legs, like
Yes,
it comes
of
out of
course.
their brain or head or whatever, and that's how they pass out. And I was just wondering if that's something that can be like you can train and get better at.
Yes.
That doesn't really make sense to me, or if people are just equipped better to handle it than others. I was just kind of wondering if you could explain that whole thing. Thanks.
Yeah. Now, anyone that has been a fighter pilot that's trained for this, I'm giving you a lay person's viewpoint on this. So if you have expertise in this field, please call in because we'd love to talk to you about it. But they do high G training. You can train for this. And they subject them to high levels of acceleration, usually using a centrifuge.
Yep.
So you've seen those things
Oh,
where
yeah.
they spin
Oh,
around.
yeah.
And they design to these trainings to prevent G-induced loss of consciousness. And you know, if you take a 90-year-old person and put it in there, they might be able to withstand 2 Gs.
Yeah.
But a fighter pilot may be able to withstand, I don't know, I've heard 4 to 6 Gs and maybe more than that. So you know, untrained individual can black out between 4 and 6 Gs, and particularly if it's done suddenly. Roller coasters are at most around 3 Gs, but I know I've felt a little woozy when I've done, what is the one, Thunderhead at Dollywood. There's one turn on that. Oh, no, that's not right. It's a Tennessee Tornado.
There you go.
When you do Tennessee Tornado, you do 3 loops, and when you go up, you look to the left, and you see these 3 loops. It's like, oh, shit.
So
I have
loop-de-loop-de-loop.
I have to do that, and it's about 3 Gs. And so you get loss of consciousness at different levels depending on your body's ability to withstand that. Now, I do know that they can use suits that exert pressure to the bottom part of the body under high Gs to allow people to withstand greater G-force, because what happens is, he's right, if the G-force is from the head to the toe, blood is going to rush out of the head and preferentially go to the legs and the feet, and depriving the brain of blood is a bad thing, and you'll get tunnel vision first, and then you'll get loss of consciousness.
Yeah, and you can see that tunnel vision coming.
Yeah, and that's right. And we're able to survive G-forces that are perpendicular to the spine. That's why we sit up. And when you anyway, so that's what I know. Constant 15 Gs for a minute can cause death in somebody.
Wow.
So a trained, fit individual wearing a G suit, and this statement I'm getting from Wikipedia, so we'll do more research on this. But wearing a G suit, and they're trained and they're fit, and they can sustain up to 9 Gs without loss of consciousness.
And they work on the breathing technique where they tighten their abdomen, they tighten all their quads so all the blood doesn't go down to their body.
Sure.
So.
And hell, at my age, when I stand up, that's too many G-forces. Blood starts rushing out of my brain. Tacey's seen me just bend over, and I'm going, gonna faint, and I just bend over and put my head down, and it gets better. But basically, that is a different situation. That's where my autonomic nervous system that controls blood flow by contracting to increase resistance to flow, to pump blood up into the brain, is not fast enough. So when I stand up, my sort of fluid level drops, and what's supposed to happen is immediately your blood vessels start to clamp down to increase resistance. If you increase resistance to flow, you're going to increase pressure. If you have the same amount of flow, and that will increase the blood pressure into the brain, you'll get good blood flow. Well, when you're an old asshole, like I am, you stand up, you start walking, all of a sudden you realize very quickly
gravity
that
wins.
It didn't work.
Right.
And so your blood vessels are just sitting there going,
yeah, they're like balloons instead of vessels.
Right, and then now the blood is rushing out of your brain into the lower body, and you start feeling faint. If you ever see somebody do that, by the way, don't support them upright. If they're going to faint, help them to
Go down,
have a
not-
soft landing,
not crack their cranium.
protect their head and their neck,
Yep.
and then if you need to, if you don't have a chair nearby that you can prop their feet up on, sit in front of them, with their feet at your
in your chest,
on your chest,
Yeah.
and then put their feet on your shoulders.
Yep.
And if you do that, if you kneel in front of them and put your feet on their shoulders, or just stand there and hold their feet up, the blood will rush back to their brain and they'll wake right up.
Yeah, they'll feel
But
better.
if you hold them up, blood will continue to rush out, and they will have a thing called a pseudo seizure. Will look like they're seizing,
Mhm.
and they actually are kind of seizing because the body really doesn't like that.
Yeah. Did you see a couple years ago the Texas Motor Speedway? They where they do NASCAR. They tried doing Formula One cars there, and they were doing testing, and they just started testing, and like
they were all feigning. And
the first guy
driving
went around and
just
wrecked.
ran off.
Yeah, and then the next guy did the same thing, and they're like, "Whoa, something bad's happening here." And they were pulling so many G's going around that they didn't know they were going to have that many G's.
Is that
They were
right?
going out and they wrecked us like 2 or 3 in a row, and they stopped it. They stopped it right then.
So it's Formula One
Formula
on
One.
a NASCAR track
Right.
oval.
Yeah, it's next.
We got to
to
look
track.
that up.
Yeah, it was Texas Motor Speedway because it's a huge, like 2.5 mile track, I think. Or 2
Wow.
mile track. So those dudes
Wow.
are burning it around the corners there, and just start dumping. And
You could calculate. I mean, that's a physics question for first-year physics.
Mm-hmm.
Given the slope of the curve, at what you could, and it's a calculus problem,
Mm-hmm.
figure out where the what speed they would have to go to hit 9 Gs.
Mm-hmm.
Or what speed they would have to go to hit 6 Gs.
or 4,
or whatever,
yeah. Go way below that,
and make sure that they always stay below that. So that would be really an interesting calculus problem. If anyone wants to calculate that for us, I don't know what the slope is of that track.
It's not super high, which is why they reckon it's not like Bristol where it's really pitched.
Yeah.
It's a little flatter.
So they had to really pull hard because
really hard.
This is a simple calculus problem as well, or a physics problem. They will cant certain roads at an angle, and you can calculate that if you go the actual speed limit, let's say 45 miles, even if it's black ice, you will not skid either toward the curve or away from the curve. You'll do a straight line around that curve. And that's why they do it that way. And they'll have these speed limits. And if you'll actually go the speed limit on curves like that, even if it's covered in ice and it's a frictionless surface, you will not wreck. It's pretty interesting.
That's cool.
So you can design a curve on one of these things the same way so that you don't have to pull a bunch of G's because it's effortless to go around the curve.
Mm-hmm.
Anyway.
I was corrected by John. He said it wasn't actually Formula One, it was kart. Which is still, I think they're open wheels. I think.
Okay.
Yeah.
Well,
Sorry
we'll,
about that,
we'll
John.
look into that.
Yeah, we're close.
That's interesting.
Yep.
All right. Another question about
Hey,
premature
Dr. Steve, it's
ejaculation.
John from Chicago.
Hey,
How
John.
are you all doing?
Good, man. How are you?
That's great. Hope you're great. Hope your summer's starting off.
Thank you, sir.
I listened to one of your last episodes on the podcast, and they were talking about, I think you were going over, kind of like premature ejaculation or erectile dysfunction. And one thing I've always thought or heard, rumor mill, is that, if you do, try to treat erectile dysfunction with Viagra, maybe you're too young, or if you do it too often, that you could form a dependency on it. Is that true? Is there any validity?
Okay, we're running out of time, but I have not seen any studies for that. As a matter of fact, most of the information that I'm been made aware of, that there's no type of dependency on PDE5 inhibitors.
I may say maybe
So
a
that's-
mentally,
right?
Yeah, but not physically.
So those things are great if you don't need them, but you're having performance anxiety and you're having difficulty. We recommend having a Viagra in your back pocket so that you know that you'll be able to perform. And then most people don't have to perform. You remember that guy that we talked to that couldn't complete the transaction, and we
Mhm.
said, "Hey, was it psychological or not?" He wrote me back, and he said, "Since we had that discussion on the air, he hasn't had any problems."
Awesome.
So we had identified that as being a psychological
Right on.
issue.
Well, congratulations.
So Scott's right. You can have psychological dependency on these things, but to my knowledge, there's no physical dependency. We don't recommend that you use it if you don't need it, because really you should be using medications for what they're indicated for. But, that's a free country. So, all right, thanks to everyone at SiriusXM and our listeners. Until next time, check your... I got to do that over again. I fucked that up. Hang on. Sorry. Thanks, everyone. Until next time, check your stupid nuts for lumps, quit smoking, get off your asses, and get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. All right. Now I got to join all those together. It's going to take a minute. Sorry. Any other questions in the waiting room?
Yeah, we got actually a really good one. Colin's got one.
Okay. Colin Carnes?
Yep, let me find it.
He always has good ones. I'm starting to wonder if he's really Stacy DeLoach and he's forgiven us, and he's coming in calling himself Colin Carnes because he has good questions.
I doubt it.
You doubt it? Okay, yeah, I doubt it too.
Do people with the gallbladder need to be extra mindful of the amount of fat and cholesterol in their diet? That's a very
sometimes
they do occasionally.
Yep.
And
GVAC had that.
Yep.
He had post cholecystectomy syndrome.
Yep. Which is treatable by cholestyramine.
Well, ooh.
And
now, did you know that, or did you just remember that from us talking about it?
I don't know. I just knew it.
Yeah, very good.
But certainly need to be leery of what they eat, because sometimes you can't eat stuff that's way too fatty, and it can cause some little spasms in your gallbladder.
Yeah,
make you feel yucky.
Hey, it's Joe DeRosa here, and you're listening to Weird Medicine.
How about that? That's Dr. Caldera on Breaking Bad, or Better Call Saul. Do you know that?
Mm-hmm.
You did?
No.
No, I didn't think so. All right, you want to do some podcast action?
Sure.
All right. I think I'm going to throw that in there. Okay. Here we go.
Hey, it's Joe DeRosa here, and you're listening to Weird Medicine.
If you ever get lost in a corn maze, just follow your ears. Why aren't windows good liars? Because you can see right through them. Sometimes people ask me if I speak lizard. I don't, but iguana learn someday.
If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by two really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of, a clown.
Why can't you give me the respect that I'm entitled to?
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic echographic and a pulsating shave. I want a magic pill for all my ailments, the health equivalent to Citizen Kane. And if I don't get it now in a tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve! Take a cowboy. Do the vertebrae. I need some suction.
From the world-famous Cardiff Electric Network studios, it's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio, now a podcast. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medical practitioner who gives me street cred. the wacko alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
And Tacey will be here momentarily. This is a show for people who would never listen to a medical show on the radio or the internet. If you got a question you're embarrassed to take to your regular medical provider, or if you can't find an answer anywhere else, give us a call at 347-766-4323. That's 347-POOHEAD. Follow us on Twitter at Weird Medicine or at DrScottWM. Visit our website at drsteve.com for podcast, medical news, and stuff you can buy. Most importantly, we are not your medical providers. Take everything you hear with a grain of salt. Don't act on anything you hear on this show without talking over with your doctor, nurse practitioner, practical nurse, physician assistant, pharmacist, acupuncturist, yoga master, whatever. Good Lord, that list is too long. Tacey gets mad if I read the whole thing. Somebody texted to me on the voicemail line that the list at the end of the show has gotten so long that it's half the show, and it's like nobody listens that long. Mm-hmm. Who listens to that? When they hear the music, they just click, okay, next one.
One would think so, yeah.
But there is some ridiculous stuff going on on the shout-outs at the end of the show. Please check out stuff.drsteve.com, stuff.drsteve.com for all of your online shopping needs. And if you will check out Dr. Scott's website at simplyherbals.net, that would be a good thing. And Cameo is still a thing. And if you want me to do Cletus or Myrtle, I'll do that. Or I'll just say fluids and secretions to your mother. We did that at Mother's Day. A bunch of people wanted me to do cameos where I just said fluid to their mother. You guys are weird, but they're cheap. I just like doing it. So it's I've done like 100 of them, and I think I've made, I don't know. We worked it out. Beck and I worked out. I told him how much I've made and how many I did, and it was like $6 a thing. So I'm not doing it for the money, if you know what I mean. I'll make it fun if you want me to. And check out Tacey's Patreon, and it is Tacey and me, and we are doing the Patreon Weird Medicine Special Edition, where Tacey just gives me hell and we answer questions that are exclusive to Patreon listeners. But we also have another show called The Exam Room on there, and that is exclusive to Patreon, where we have celebrities come on and ask me questions. It's kind of fun. And we did have Dr. Caldera, a.k.a. Joe DeRosa, the owner of Joey Rose's Sandwich Shop in Manhattan, and one of my favorite people. And if you want to see how surprising that is, check out the first time we ever encountered each other by going to YouTube and search for Joe DeRosa versus Dr. Steve or whatever. And I didn't really do anything that funny that day, but what I did do is turn the room against him, and he finally just gave up. And it was quite funny. And I was sitting in the library on the cancer floor when that went down. And if you're ever wondering what, I guess I could play some of this, couldn't I? Why not? I mean, it's not like I'm going to get a copyright strike. I could dissect it a little bit
before everybody.
Yeah.
Clicks off.
Yeah. Okay. Go fuck yourself, Dr. Scott. Let me see. Dr. Steve versus Joe DeRosa. Oh, it comes up right there. Oh my God. Okay. It's like the first thing. Okay. So what happened was Joe was on the show and he kept saying something. I can't remember what it was, but he was talking. It was some societal concept. And he kept saying it over and over again. I was just screwing around. And I quoted him saying this, and then I just cut it off and I went, "We heard you," in all capital letters, right? And just tweeted it out. Well, apparently Anthony saw it, or probably Sam Roberts, because he likes to stir up shit, saw it and showed it to Joe, and he was like, "Get him on the phone." He wanted to give me a good old grilling, right? And so I called in, and while I was on hold, I heard this thing that they were doing about Roland Campos, and it it was this bit that one of the interns did called "Don't Get the Panda Angry," and it was going, "Don't get the panda angry," because if you don't know that, you won't understand what I said at the beginning. But I heard that while I was on hold, and I was trying to think of things that I could say because I knew he was getting ready to shit on me, right? So I'll just play a little bit of this.
He's on the phone.
Oh, Dr. Steve. Hey, you know what? Excuse me, Dr. Steve. Well, Dr.
Now you
Steve.
can hear Joe laughing like, oh boy, I'm really going to get this guy.
Yes.
Hi.
Hello.
Well, there seems to be a little bit of a problem between you and Joe DeRosa.
And girl laugh DeRosa.
Okay, so the first thing I said was old girl laugh DeRosa because he has a high-pitched laugh. And I wanted to make the first blow if I could because I knew after that I was going to get cut to ribbons.
Oh, shit.
So wait.
Well, there seems to be a little bit of a problem between you.
You can hear me going, oh, jeez.
And Joe DeRosa.
And girl laugh DeRosa.
Oh, shit.
You know what, Steve? Listen, first of all, I want you to shut your dumb prescription writing face.
DeRosa angry.
Oh, shit. Oh, shit.
Big Boy's got a podcast now. He thinks he's one of us.
Okay. At that time, I had a show on Sirius XM, but I didn't have enough wherewithal to point that out to him. Also, one of the jokes that I had that I didn't use was Joe was on a show, I think. I was going to ask him, hey, what was that HBO show you were on, Joe? I remember seeing you on that. It was called Bored to Tears. And I was going to say, and I didn't want to sound like Stuttering John telling the jokes I was going to say, but I thought this one was pretty good. And I was going to say, oh, no, I didn't mean your audience. I meant, the show you were on. And, anyway, so... It sounded better in my head.
Yeah.
Anyway, so yeah, check that out if you want to. Now that the rest of it is pretty self-explanatory, but that beginning part is difficult to understand. But anyway, that's what I've got. You got anything? Let's get on with the show.
No.
Okay. Then I'll cut to where we're talking about Simply Herbals. All right, and I don't think we need to add anything to the end unless anybody's got a question we want to get to here at the end. I'll just go ahead and wrap it up.
No,
I
think
we'll play. You got time to play a tune?
Yeah, I got time to play one.
Okay, just one
or two.
Okay. All right, here we go. All right, Dr. Scott. Well, let's get out of here. Thanks, everybody. Thanks always goes to Dr. Scott, Tacey. Hopefully, Liam found his wallet. We can't forget Rob Sprance, Bob Kelly, Greg Hughes, Anthony Cumia, Jim Norton, Travis Teff, that Gould girl, Lewis Johnson, Paul Ovcharsky, Kim Chickens, Amy from Kentucky, Chowdy 1008, Howdy Gooplunk, Eric Nagel, Sean P., the Port Charlotte Whore, the Saratoga Skank, the Florida Floozy, the St. Pete Barkeep Blower, the Dolly Museum Diddler, the Bolshoi Ballet Bimbo, Percy Dumb, Roland Campos, Sister of Chris, Sam Roberts, She Who Owns Pigs and Snakes, Pat Duffy, Dennis Falcone, Matt Kleinschmidt, Dale Dudley, Holly from the Gulf, Christopher Walken's Double Steve Tucci, the great Rob Bartlett, Adam Goldstein, Vicks Nether Fluids, Cardiff Electric, Casey's Wet T-Shirt, Carl's Talipes, Equina Veris, Tucker Dixon, producer Chris, Jenny Jingles, the inimitable, Vincent Paulino, everybody, Eric Zane, Bernie and Sid, Martha from Arkansas's Daughter, Ron Bennington, and of course our dear departed friends, GVAC and Fez Watley, whose support never went unappreciated, and let's throw Barry the Blade in there as well. Rest in peace, my friends. Listen to our Sirius XM show on the Faction Talk channel, Sirius XM channel 103, Saturdays at 7 p.m. Eastern, Sunday at 6 p.m. Eastern on demand, and other times at Jim McClure's pleasure. Many thanks to our listeners whose voicemail and topic ideas make this job very easy. Go to our website at drsteve.com for schedules, podcasts, and other crap. Until next time, check your stupid nuts for lumps. Quit smoking, get off your asses, and get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. Thank you, everybody. All right. There we go. Let me just save that.
Okay.
And Felt like I was rather inarticulate today. I felt that way all day. I think it's just getting old.
You and me both, buddy. Lord.
Okay, Weird Medicine recording. What's the date today?
25. 5/25/22.
Okay. All right. All right. We're backed up. We should be good. Anybody have any requests? Well, not that we could play them.
Anything they want to hear butchered? Yeah, and I was going to tell Ryan's daughter wound up having to have the surgery.
Oh, for the
fracture. And,
yeah.
But he said she did well. So.
Oh, good.
So
I know they were trying to avoid that.
Yeah. That's a good thing. Hopefully she's feeling well.
Wait, his daughter just had surgery and he's sitting in here with us?
Yeah.
Everybody should really be listening to Radio Gunk today because Monique was going to have John on.
Now, what's that?
Oh, he was all wound up because she was going to ask questions that trolls wanted to know the answer to.
There you go.
Did you find it?
The trolls know.
No? Oh, no. Where's he been?
Andy's car, it's gone.
Huh?
It's either in Andy's car or it's gone.
Did he call Andy?
Andy's working.
Well, we got to stop his...
Pissy ass mood, too.
Well, I don't blame him. I mean, I know when I lose something, I'm pissy.
I know.
We need
but
to...
I'm like, where can I look?
Yeah.
It's not here.
Yeah. Yeah, okay. Well, that's not helpful, but he needs to call Andy at work.
He won't call Andy at work.
When's Andy get off?
Midnight.
Well, he's got to call the bank and get a new card, and we need to get,
It's 5:40.
Isn't that virtual teller open until 7?
The big doofus child.
I'm going to get him one of those Apple things.
He said he needs one.
Yeah, and just put it in there. He needs to have a ritual. Okay, anyway.
Yeah, like me. Mine goes in my sling bag. I don't know where it is.
Well, I do. I'm constantly inventorying my shit because he gets that from me. But I don't lose stuff anymore, knock on wood, because I'm always inventorying it. Although I lost my fucking cane, 2 days ago, and I don't know where my lab coat is. So, but the things like my wallet, because I lose shit all the time, but I don't lose my wallet because I've developed a technique to make sure that it's always in one place or the other. It's either in my pocket or it's on my nightstand. That's it.
Yeah.
It's never anywhere else. And he's always taking it out and putting it places and then going, well, I'll remember this. So our new instrument showed up today, and next week we will have a rhythm machine that actually will help us. Yeah, it went good. Yeah.
Not as good as you were here.
You were missed, but
yeah, it was better when you were here.
You want to hang out and do a song with us?
No, I'm bummed with the week.
All right. Well, I'll be down a little bit.
What you gonna play?
Oh no, you pick something.
We hadn't done in a while.
Now we still need to get that Arcade Fire down.
Yeah.
And I would like to do the funeral still. I really think that doing the alt rock stuff with you, with your voice, and the but the acoustic mandolin and a bass is the way to go. I think that's the best stuff that we do.
Oh yeah. Totally.
Not that any of it's any good.
No. Some of it's less bad than others.
But I'd like to do like an EP of covers of like alt songs that we record in the real studio over there and next door. And just put them out there for our listeners, not sell them or anything, obviously. We can't monetize them. But I think it'd be fun. I'll get my stand-up bass, and we'll do the whole thing.
That would be good.
All right, what do you got?
I was thinking about maybe The Deal. Remember we used to do that 100 years ago.
What is it? How's it go?
The Grateful, it's an old dead song. It's in G, and it's since it costs a lot to win and even more to lose, it's a G, B minor, E minor. It's a, if you go to that guitar,
yeah,
it's a, just go to the G. Since it costs a lot to win.
Oh yeah, I like it already.
Even more to lose.
Okay, when you sing since, you want that to be G?
Yep.
Okay.
Since it costs a lot to win and even more to lose, you and me better spend some time wondering what to choose. Goes to show you don't ever know. Watch each card you play it slow. Wait until that deal goes down. Don't you let that deal go down, oh no. Yeah, needs that little swing. There you go. I can't tell if I'm under headphones. All right, you ready?
I guess, yeah. And that's it. That's the whole song, right?
Yep.
There's no C part. It's just A, B, A, B.
A, B, A, B, A, B, A, B.
Okay.
Yep. And
All
then
right.
the outro, we just...
All right, let me turn my bass down a little bit. I'm overwhelming you.
Well, since it costs...
Okay, how do you want to start it? Why don't we do...
Since it costs...
Let's do G, F, C, G, the don't you let...
Let's just do the chorus. Let's do the chorus, yeah. Since it costs a lot to win and even more to lose, you and me better spend some time wondering what to choose. Goes to show you don't ever know. Watch each card you're playing down and slow. Wait until that deal goes down. Don't you let that deal go down, no, no. I've been gambling hereabouts 10 solid years. If I told you all that I know is a turn on both your ears. Goes to show you don't ever know. Watch each card you're playing down and slow. Wait until that deal goes down. Don't you let that deal go down, no,
no. Oh. Ah, shit.
Well, since you poured the wine for me and tightened up my shoes, I hate to see you sitting there with the lonesome blues. Goes to show you don't ever know. Watch each card you play it slow. Wait until that deal goes down. Don't you let that deal go down. Don't let that deal go down. Wait until that deal goes down. Wait until that deal goes down. go down. Don't you let that deer go down. Wait until that deer go down. Oh no.
Okay, I effed that up royally, but I think I've got it now.
Yeah, you were on there for the most
No,
part. Yeah, hell, we hadn't played it forever, ever.
We played that before.
It's been, yeah.
Now, can you play that G diminished at the end of Lose?
Yeah. So what? Yeah. So that's what I was going to tell you. I'd forgotten, but the way I like to play it is go to a G7, C7. Wait until the deal goes down. Oh no. You know.
All right.
You want to do it? Let's do it one more time.
Well, I know everybody's bored of it, but
Yeah,
I would
sorry.
like to get it right. So
Yeah.
I've got to memorize it, and then it's the.
Yeah, everything you were doing sounded pretty good. Dr. Steve playing that mean bass. Yeah, love it. My voice is unique and it's full of snot currently. Full of pollen. That's all right, though.
Okay. All right, let's try it. Now, if I could commit this to memory, I'd be a lot better off.
Yep.
All right, you ready?
Yeah, we'll just go right through the
I'll do the chorus
yeah.
twice. Yeah.
Yeah.
Okay. 2, 3, 4.
Well, since it costs a lot to win, even more to lose, you and me better spend some time wondering what to choose. Goes to show you don't ever know what cheats card you're playing. Play it slow. Wait until that deal goes down. Don't you let that deal go down. No. I've been gambling hereabouts 10 solid years. If I told you all that I know, it would burn on both your ears. Goes to show you don't ever know what cheats card you're playing. Play it slow. Wait until that deal goes down. Don't you let that deal go down. No, no. Since you poured the wine for me and tightened up my shoes, I hate to see you sitting there closing those lonesome blues. Goes to show you don't ever know what each card you're playing. Play it slow. Wait until that deal goes down. Don't you let that deal go down. Wait until that deal goes down. Wait until that deal comes round. Wait until that deal goes down. Don't you let that deal go down. Don't you let that deal go down. Don't you let that deal go down. No, no. go. I missed my my little sea walk.
I'll work on that. Of course, I say that every time, and I never work on anything. But
all right, boys and girls.
All right, thank you all.
Ladies and
Thanks for
gentlemen,
indulging us.
and all of our friends.
You're quite delightful human beings.
Love it. Loves the strings. I've got some pretty good strings. I don't know if y'all can see or not, but I've got a pretty fancy little mandolin.
Oh, is that your Audie Ratliff?
Yeah, it's one of
Yeah,
my
show 'em.
Ratliffs.
Yeah.
This
You
is
want
my,
me to? Can you show it to the camera?
Yeah, this
Hang
is
on.
my.
Hang on. Tell them about
a
it.
fancy. It's called A style, which people like to say it's my asshole, but it's a fancy A.
Nobody
style.
says that. Yeah, don't show it to the microphone. Show it to the
No,
camera.
I am.
Oh, okay.
Yeah. No, my camera's here. My camera's here.
Yeah.
But it's a pretty cool little. It's got some fancy F holes in here. It's an A style, but it's got fancy tips and it's just beautiful.
And
Made
it's
by
custom made
by a local guy,
Audie Ratliff, who makes mandolins for freaking everybody.
Yeah, people
Let me
actually
see.
know how
Let
to
me
play
look him
it.
up real quick.
Yeah, he's retired now.
What?
Sadly. Yeah, I was gonna have him make me an.
You know,
octave.
when I first met him, this is how old I am. He was a young hippie dude.
Yep.
Now he's an old
fart,
old redneck
Like us.
dude. Not redneck, but mandolins. Let me see who plays them. Let me
Thank
see.
you, Kim. We do appreciate y'all. You guys make this show a whole lot more fun. That's for sure.
Yeah, okay. I'm Audie Ratliff. Go to ratliffmandolins.com. And, oh, yeah, tell them Dr. Scott and Dr. Steve sent you.
Yeah, I've spent enough money there. He should be happy to see him. He'd be happy to see him, buddy.
But, yeah,
It's
I
good
knew
work.
his dad. I knew his dad really well. He and I helped him build his music store. So he had a little tiny music store he was building on. And my kids, my wife's kids, they were my kids at the time, were taking lessons over there from a guy named Scott Gould, who was an amazing mountain music guy. Who I had Crystal Shipley, who won the Fiddlers Convention at Galax, told me that you weren't a real bluegrass player unless Scott Gould made you cry at least one time in your life. And anyway, so I started hanging out there, and the guy that ran the place, his name was Tom Ratliff, and he played dobro, and he would have a hootenanny in his store every, I can't remember, Thursday night or something, or Tuesday night, and they would broadcast it on the radio. And so everybody from around would come and pick, and they would just play classic mountain songs and grin and pick and everything. And I became close friends with Tom and his wife, and I really miss him. You know, he's gone now, but I just remember Audie. He said, you know, Tom said, my son's going to start a mandolin place, and he was this young, scrawny kid with long, you know, hippie hair like I used to have, and as Scott still has, which you wouldn't know because of his ridiculous man bun. But anyway, and now you look at Audie, and this picture on his website is from a while ago. 40 years of building. God, that's right. Oh my God,
40
how old
years.
am I?
Holy cow! Isn't that crazy?
Yeah.
We need to play a mountain song.
Yeah, we can do that.
I'll
play any of that stuff that you want to play.
You know, one of my favorite is it's called it's by Steve Earle. It's called
yeah, it's a good one.
The Mountain. I was born on this mountain. Or actually, if you want to do a real hillbilly one now, we could go back to Larry Sparks and do a little blue Virginia blues.
Well, we could just play regular mountain music too. I'm okay with that.
Yeah, I could play.
Yeah, you got to look at all these people: Jennifer Banks McLean, Stephen Cagle. You know him?
I don't think so.
James Shelton. James Shelton was lead guitarist for Dr. Ralph Stanley's Clinch Mountain Boys. Anyway, he's quite the.
Let's see. Yeah, we need to do a straight up bluegrass.
Yeah, I'll do that. I've got charts for all kinds of shit.
This old Larry Sparks song. It's called Blue Virginia Blues.
Do you know it?
Oh yeah.
Okay.
It's in really CEF. Have you ever been to Richmond in November? When the cold Virginia rain is coming down.
We should have
Friends
Mike
don't hear
Milhorn come in here and play with us.
pleasure. When you're all alone and a stranger in this town. It's a good old
Okay, you
bluegrass,
want to play
yeah.
it? If you know it, I can play it.
Yeah, if you, it's
Okay, I
it's
can
very
play
straight.
this
Yeah, it's
stuff.
very straightforward. It's a yeah.
I should play my stand-up for this stuff.
Yep. If you'll look up just real quick in that Ultimate Guitar, it's called Blue Virginia Blues.
I got it.
Oh, you
I'm
already got it.
looking
Oh,
at it,
cool. Yeah, and we'll play it in C. Yeah. Oh, yeah, that's what I want to hear right there. Perfect. That's what I like to hear. Some old school.
Okay.
No, I was no. Keep you keep doing your
No,
thing.
yeah,
I
that's
was gonna
okay.
catch
You
it.
go, and I'll catch up with you.
Have you ever been to Richmond in November when cold Virginia rain is falling down? Friends, I'm here to tell you it's no pleasure when you're all alone and a stranger in this town. Don't take me wrong, I do like East Virginia, and Richmond's full of hospitality. Except for one Virginia girl I know of who made a perfect wreck out of me. Blue Virginia blues, ain't no blue like blue Virginia blues. Ain't no blue in the whole wide world gonna make your heart like Virginia girls.
Oh, jeez.
Ain't-
Okay, wait a
I'm
minute.
sorry.
No, that's okay. That
It
goes
just changed.
really fast.
It goes
Okay.
backwards. Yeah, I'm sorry.
Okay, let's start at Blue Virginia Blues.
There we
Okay,
go.
1, 2, 3, 4.
Blue Virginia blues, ain't no blue like blue Virginia blue.
Oh.
Ain't no blue in the whole wide world gonna break your heart like Virginia girls. Ain't no blue like blue Virginia blue. This is the best part right here. She called me up, St. Paul, Minnesota. Said I need you here in Richmond right away. Take the bus, I'll meet you at the station. And bring some clothes, I might want you to stay. My bus pulled in the station late that evening. Oh, was it the boss?
No. Okay.
No, you just
Sorry.
go back to verse 4. That's good. Yeah, back to verse 4 on C.
Here, let me get you some reverb. There you go. Okay.
My bus pulled in the station late that evening. Ain't a soul in this place except for me. She must have changed her mind or she's forgotten. And her name ain't in the phone directory. Blue Virginia blues, ain't no blue like blue Virginia blues. Ain't no girl in the whole wide world gonna break your heart like Virginia girls. Ain't no blue like blue Virginia blues. I just back to the C, and then we go back to, and we just go back to the chorus. Okay. Back to the F. Yep. 3, 2, 1, and Blue Virginia blue. Ain't no blue like blue Virginia blue. Ain't no girls in the whole wide world gonna break your heart like Virginia girls. Ain't no blue like blue Virginia blue. One more time. Oh, ain't no blue like blue Virginia blue.
Okay. You gotta warn me about that. Okay, yeah, we'll work on
we
that.
get that one now. That's
a good one.
That's a great.
I gotta
song.
play that on
That's
the
some
stand-up,
hillbilly.
though. Yeah.
That's Kim Chickens. Every KC. Now KCC's the hillbilly.
All right, let's try some harmony on that. Let's go with the Blue Virginia Blues. You ready?
Yep. Give me 3. Hang
1,
on. Let me get my. Give me my back.
Because Myrtle's gonna sing with.
Oh, we're going back. You going to the final chorus?
Well, yeah, let's just do it.
You're
And
gonna do the
Myrtle will
verse.
sing with you. Blue Virginia Blues.
All right, so we're going to go.
We'll do the
Let's do. You'll do just verse 5 and then in the final chorus.
Sure. It's all the same, right?
It's all the same, yeah.
Okay.
So we'll just go to verse 5 and then we'll do the chorus. Okay. I wish I had the money for a taxi and a warm and cozy place to lay me down. Instead of standing all alone in Richmond, while cold Virginia rain is coming down.
Oh, okay. Oh, it's different?
Yeah, I'm not so sure that this was chorded very well, to be honest with you. What I'll do is I'll play it this weekend and make sure it's correct. But all right, you ready, Myrtle?
Yeah, start at the beginning.
Okay.
Let's go to the beginning. Have you ever been to Richmond?
Yeah, that's cool. Yeah.
Okay.
Yeah, let's do it, because at least we know that's close.
Okay.
Have you ever been to Richmond in November when the cold Virginia rain is coming down? Friends, I'm here to tell you it's no pleasure when you're all alone and a stranger in this town. Don't take me wrong, I do like East Virginia. Richmond's full of hospitality, except for one Virginia girl I know of who made a perfect wreck out of me. Blue, blue Virginia blues. Ain't no Virginia blues. Ain't no girl in the whole wide world make your heart like Virginia girls. Ain't no girl
in the holler, don't you know? That's shit. I can't.
All right,
I can't
guys.
do that.
Singing.
I could overdub it, but I cannot play it and do it at the same time.
All right. All right, guys.
Well, y'all are a bunch of good
All of you
ones.
guys that suffered through
We
that.
surely do appreciate you.
You should get like a Purple Heart or something.
I hope you get you some good Beatles tonight. And, well, a little taste of corn squeeze never did hurt nobody. I'll tell you that. It's good for what else. Once Delmer said them revenuers came after him and got his still, and Lord, it was a mess. It blowed up and took his eye out. He's got a glass eye now, don't you know? Well, he got him another still up there. They didn't ever find that, and so he's all right. He's still making him corn squeezes. He can make apple pie and peach pie.
Can you make a cherry flavored too?
Yeah. Well,
like a cherry
I
flavored.
don't know who is this on my party line. I don't know who that is. That's a talking, but anyway. And he raises chickens, don't you know? And he's got A1 eggs and A1 large and B1 large and B2 large, and they can't be too large, don't you know? And I tell you, we got a good crop of tomatoes this year. We surely do. And we eat what we can, and what we can't eat, we can. Don't you know that? That's old country humor there, I'll tell you. All right, everybody. Thank you.
Thank yous.
That's
Thank yous.
She lives in there in my head, and she'll just go on and on and on until everybody's like, "Shut up!" All right.
See you guys. I see you in a week.
Bye.
Have a good week.
That was just for you. The two people left, and look at the drop off.
I was gonna say, yeah, the dropping off.
Since Myrtle
like flies.
talked, since Myrtle started up, yeah, we. All right. I don't blame you one bit. All right. See y'all.
Thanks, guys. Oh, I love it. I love it. That's
Oh,
good.
wait. Hey, somebody said they were looking up the. Oh, Sean. No, who was it that was looking up the Texas cart thing? They said they were pulling 5 and 6 Gs. Sean said that. Looked up an article about the Texas cart incident. They were pulling over 5 Gs for 18 of the 22 seconds it took to complete a trip. 24-degree banking.
Yeah.
So we need to. That's wild. Okay, late for church by the drive-by truckers.
Oh yeah. Oh, that's what I was gonna do.
It has a mandolin solo that Dr. Steve said didn't exist. What? No, it's. I just don't want Dr. Scott playing mandolin solos when it's just bass and mandolin.
Yeah. It's oh yeah, and it's straightforward too.
Yeah.
It's really straightforward.
I miss all this stuff that's going on in the chat room.
Well, that's because you're like kind of Dr. Steve. You're supposed to be paying attention to what's going on.
Well,
you're
know,
supposed to be
old,
talking.
Carl can pay attention when he's doing his show, but the one that was a master at it, which was old Wood Floor Liquor.
Yep.
He could do a show and be watching the chat room and typing while he's talking. Oh, that always kind of blew me away.
That's pretty impressive. Yeah, no, this is straightforward.
Kim Chicken says Myrtle tells good jokes. Well, she likes Proverbs too, Kim, but she always gets them wrong. Well, don't you know? Wait, wrong one. Well, see a penny, pick it up. All the day you'll have a bright, shiny penny that you can buy penny candy with. That's the truth there. It's a fact. Back in the day, you could buy candy for a penny. You can go up to Ernie's Market and get you a couple of hard-boiled egg and 2 pieces of licorice there for about a nickel. Old Ernie will give you credit, too. He surely will. Did you know that, Dr. Scott?
I didn't know that. I didn't know. I was on a wire. I was on a wire.
All right. See y'all later. Jeez. Damn idiot. Goodbye. Wave to your public, Scott.
See you guys. Peace.